Hey guys, welcome to my channel. My name is Dr.Isang. The goal of this channel is to educate, motivate, but most importantly, elevate your knowledge regarding certain medical topics. In today's topic, we are going to be talking about hypertension. Now, why I'm excited about this topic is that I'm also going to focus on an important part of hypertension that isn't talked about a lot. Over 90% of the people with hypertension fall into one category known as primary hypertension. The other 5 to 10% fall into another category, and it's extremely important to know this for the management of hypertension. So stick around to hear what the other 5 to 10% causes of hypertension are. Now, what exactly is blood pressure? Blood pressure is the force that is required for blood to move throughout the body. You can imagine watering the grass with a water hose. There's force that's needed for the water to come out appropriately to water your lawn. In the same concept, the blood pressure is the force that's needed to provide blood flow to the rest of the body. Now imagine what would happen if you put a little bit of stress in that water hose. Exactly, the hose would have to work a lot harder to pump the lawn. The same concept can be made in regards to hypertension, in regards to the artery walls becoming stiffened and the heart having to pump a little bit harder to get blood to the rest of the body. Now today, I'll be discussing the importance of hypertension, but before I dive into that, I have to talk about what the exact definition of hypertension is. Now, one of the best guidelines that we have used for this is called the JNCA. That came out a few years ago, about 5 to 7 years ago, or updated a few years ago. It defines hypertension as a systolic blood pressure, which is the top number greater than 140 and the bottom number greater than 90. It further characterizes people into different stages. There's pre-hypertension, in which the blood pressure is 120 to 129, 139, less than 80. Stage 1 is 140 to 159, over 90, over 99. And stage 2 is 160 over 100 or greater. Now, I'll be honest, these are older guidelines. And these guidelines were significantly updated to now diagnose stage 1 hypertension as a systolic blood pressure greater than 130 and a diastolic blood pressure greater than 80 to 89. And stage 2 hypertension is now diagnosed as having a blood pressure of 140 or greater, or a diastolic number, the bottom number, greater than 90. Now, the reasons for this, you may be wondering, is due to a trial that came out around 2017 known as the STRENGTH trial. Now, the purpose of this was to look at two groups. One with strict control, which defined it as having a blood pressure of 120 or less, versus the standard control, which wanted it to be around 140 or less. And the results showed that actually the people who were controlled intensively, the 120 or below, had decreased significant risk of stroke, heart attack, and other major cardiovascular events, other major heart problems. So in regards to blood pressure, it's extremely important to know that it can fluctuate throughout the day. It's typically lower at night, but it tends to change throughout the day depending on physical activity and any type of emotional stress you may be having. To be diagnosed with hypertension, it requires for the blood pressure to be persistently elevated. Now, the reason that this is important is that in 2019, it was noted that over 40% of the individuals in the United States had a diagnosis of hypertension, and that number only continues to climb and climb over time. So if it's not attended to appropriately, poorly controlled hypertension can lead to a host number of unfortunate circumstances. These include things like heart attacks, also known as myocardial infarction, heart failure when the pumping function isn't working well, enlargement of the heart or cardiomyopathy, stroke, dementia, depression, kidney disease to the point where you need dialysis, limb loss, vision loss, and other forms of vascular disease. Hypertension is very difficult to treat because it's a slowly progressive disease process. And a lot of times it doesn't manifest itself until organ damage has occurred. And this is one of the reasons why hypertension is notoriously known as the silent killer. Now, when people start to develop symptoms due to hypertension, it is because they've been having these symptoms for over a long period of time. The most common includes headache, vision changes, chest pain, and sometimes dizziness. Now, I've been asked a lot of times, Dr. Isang, am I at risk for developing hypertension? This is a very important question, but also can lead to a very important avenue in regards to hypertension, specifically risk factors. A lot of these risk factors are well known, and they include things like obesity, high salt diet, smoking, alcohol use, lack of exercise, or a sedentary lifestyle. But I must say that one of the most underappreciated risk factors for hypertension is a strong family history and people who have nutritional deficiencies, especially potassium deficiency. Because in our body, when we have low potassium, it can lead to elevated sodium levels, which itself leads to hypertension. And another commonly underdiagnosed risk factor for hypertension includes sleep apnea. So if someone has sleep apnea that is not treated, they will have episodes in which the blood oxygen content decreases during these apneic episodes or episodes in which they are not breathing. The body, more specifically the brain, sees this as an issue and sends signals to increase blood pressure and heart rate in an attempt to improve the problem with oxygenation. Over time, if this is untreated, it can lead to hypertension, but also difficult to control hypertension. These individuals are typically on multiple antihypertensives or blood pressure medications. Now, I stated previously, over 90% of people have a specific type of hypertension known as primary hypertension, meaning that there's no exact cause. But we are aware of some risk factors, which includes older age, being overweight, lack of exercise, salt, nutrition, excess alcohol, smoking, and many more. There are unfortunately some individuals who have secondary hypertension. Now, this is hypertension due to some underlying problem, whether it be decreased flow to the kidneys, which can lead to kidney failure and sometimes end-stage renal disease, to which they need dialysis. And the reason that the kidney is extremely important is that if the kidneys see decreased blood flow, it will increase an enzyme called renin. And this job is to retain water, and by doing this can lead to hypertension. And I specifically remember someone asking me a question that they have hypertension and they're on several different medications and they still can't seem to gain control of it. I mentioned to them the topic of secondary hypertension to see their primary care provider to see if they can be worked up appropriately. And they did, and were subsequently diagnosed with renal artery stenosis. There was blockage in the artery that leads to the kidneys. They eventually had this fixed and went from taking 4 blood pressure medications to now only 1. Another question that I always ask is, Dr. Isang, how can I control my blood pressure? More specifically, how can I control my blood pressure naturally without medications? Now, the best way to answer this is by treating the things that can lead to elevated blood pressure, the risk factors. So this includes weight loss, proper nutrition, stress management, getting appropriate amount of sleep, salt reduction, exercise, and following up with your primary medical provider or primary care physician. Now, if you're interested, there will be a link in the bottom that talks about this in more detail about ways you can treat hypertension naturally. Now, I would be a liar if I told you that 100% of the people who do this have complete control of their blood pressure. There are some people that, despite the lifestyle changes, still require medical therapy for optimal control of their blood pressure. And these medical therapies include things like beta blockers, calcium channel blockers, ACE inhibitors and aldosterone receptor blockers, and diuretics. Before I get into these medications, make sure you hit the like button if you've gotten any value so far. Now let's go. The first medication is ACE inhibitors. They're easy to remember because they end in pril. Examples include lisinopril or benazepril. This medication works by inhibiting the enzyme angiotensin converting enzyme and prevents the production of angiotensin II. This enzyme is notoriously known for constricting arteries, so by blocking this, you actually dilate the arteries, which can help in decreasing blood pressure. Like all medications, like I've said it previously, they are not without their own side effects. The most commonly reported is a cough, specifically a dry cough. A lot of times I tell patients that if they can tolerate it, to continue taking it, but if they can't, we have to look at other therapies that are available. A second common complaint is electrolyte derangements, specifically elevated potassium. So whenever I start someone, or whenever someone is started on these medications, ideally you want to get blood work done within the first 1 to 3 weeks to make sure that the electrolytes are stable. The second medications are aldosterone receptor blockers, also known as ARBs. They typically end with a sartan. Examples include losartan or valsartan. This medication works by blocking the production of aldosterone, and it has a similar side effects to ACE inhibitors. It can be a good option for people who are intolerant to ACE inhibitors due to that cough, but also has the same side effect of electrolyte derangements, hence the importance of checking blood work. The third class includes beta blockers. They typically end in LOL. Examples include carvedilol or metoprolol. They work by slowing the heart rate, which subsequently can help in decreasing the blood pressure. And because they do slow the heart rate, you have to be extremely careful in starting this medication on people who already have slow heart rates. So if someone's heart rate is in the 50s, low 50s, be very cautious in starting it because it can drop it even further to a dangerous level. It is also important to know that beta blockers are present in the lungs. Hence, this medication should be used in caution in individuals who have asthma or COPD. The next medication are calcium channel blockers. Medications such as amlodipine. These medications work by relaxing the smooth muscle, and by doing this can lead to vasodilatation. The common side effects are bradycardia, but the one that I see the most is ankle swelling. And lastly, we have diuretics, specifically thiazide diuretics. They are both the blood pressure medication and a low-dose diuretic or medication that help you to pee. Examples include hydrochlorothiazide or clothalidone. Like I said previously, these medications work by increasing urination, which can also lead to some adverse events such as low potassium levels. It can also lead to low sodium levels. So it's also important to check electrolytes on anyone who is started on these medications. Another side effect includes gout, because this medication can actually increase uric acid level, which is a precursor or a risk factor for gout and gout flares. Outside of these medications that I've just mentioned, there are a host of different other medications that can be used, nitrates, hydralazine, etc. Decisions for using this medication should be on a doctor-to-patient discussion. Now check this next video out that talks about why hypertension is known as a silent killer.